Rethinking the Rush, the 5G Dilemma, and Public Health. In the midst of technological advancement, the rollout of 5G networks worldwide has sparked a blend of anticipation and concern. While the fifth generation of telecoms networks promises to revolutionize our digital lives, an expert voice raises a compelling argument for caution. This piece reflects on the insights shared in an opinion article published in the Journal of Epidemiology and Community Health, emphasizing the urgent need for a thorough safety evaluation of 5G technology before its widespread implementation. The core of the concern. Professor John William Frank from the Usher Institute at the University of Edinburgh articulates a cautionary stance against the hasty deployment of 5G networks. Despite the new evidence linking 5G and COVID-19, once a myth debunked by scientific consensus, gets revisited with the primary concern revolving around the increased levels of ROS, from exposure to radio frequency electromagnetic fields, RF EMFs, that 5G entails. The newest hypothesis is that the interplay between SARS-CoV-2 infection and exposure to radio frequency radiation, RFR, from 5G and other wireless technologies could compound public health challenges by exacerbating the body's oxidative stress response, a crucial factor in the pathogenesis of COVID-19. Long COVID's debilitating effects stem from an aggressive inflammatory response initiated by the SARS-CoV-2 virus, which leads to an excessive production of ROS. This condition not only intensifies respiratory symptoms and multi-organ damage, but also mirrors the non-thermal biological effects induced by EMF exposure, including disruptions in cellular processes and gene expression. Such parallels suggest a potential exacerbation of COVID-19 outcomes in environments with high levels of RFR exposure. The technological leap to 5G involves a significant densification of transmitters, potentially exposing the population to levels of RF EMFs that some emerging evidence suggests might be harmful to health. Controversy amidst uncertainty. The controversy surrounding 5G is not unfounded but stems from four main areas of scientific uncertainty. The ambiguity surrounding the exact technology encompassed by 5G, a dearth of high-quality epidemiological studies on the health impacts of 5G EMF exposure, increasing epidemiological evidence of health effects from lower-level RF EMF exposure associated with previous telecom generations, concerns over the impartiality of national telecom regulatory bodies and their adherence to the latest scientific findings. A call for the precautionary principle. RF Safe urges the application of the precautionary principle, a strategy to cope with possible risks where scientific understanding is yet incomplete. This principle suggests that the global rollout of 5G networks should be paused until there is clear evidence confirming its safety. This approach is not only prudent but necessary, given the significant public exposure to a new form of EMF and the substantial uncertainties surrounding its health implications. As the debate over 5G technology continues, the call for a moratorium on its deployment highlights a critical junction in our technological evolution. The emphasis on safety, backed by rigorous scientific investigation, must take precedence over the rush for economic gains and convenience. Learn more at www.rfsafe.com.